My name is Charlotte Rolle. I'm an adult infectious disease physician. I'm originally from Nassau, Bahamas. I went to high school there. And then from there, I actually went all the way up north to Canada and did college at McGill University in Montreal. In college, I actually studied pharmacology, and so that played a huge role in my career today. From Canada, I actually did my first foray into the United States, went to med school at the University of Chicago, had a good time in Chicago, but it was really cold there, so just simply moved to another colder city, which was Boston, where I did residency at Harvard University at Brigham and Women's Hospital. Spent 4 years there because I was a chief resident there and, had a lot of fun, but it was still cold and decided I needed to now move to a warmer climate. And so ended up going down south to Atlanta where I did an infectious disease fellowship at Emory University. I did a 3-year fellowship. The 3rd year was a research year. I was an NIH-funded research fellow working in PrEP. So when I left fellowship, I was looking for a role in research, and that's how I ended up at the Orlando Immunology Center as the research director. So I've stayed pretty linked to academics, even though I'm here in Orlando at the OIC. I have an adjunct assistant professor role in the Department of Global Health at the Emory University Rolle School of Public Health. Here in Orlando, I actually am on staff at the University of Central Florida Lake Nona Medical Center. And at the OIC, we have a partnership with the UCF College of Medicine, where we actually mentor their medical students in their fire research program. So every year we have about 2 to 3 medical students that come and do a 2-year research program at the Orlando Immunology Center. And I am proud to serve as their research mentor, myself along with Dr. Edwin DeJesus and Federico Hinesrosa. We take care of those students. We also actually teach the HIV and hepatitis C curriculum at the Orlando Regional Medical Center Infectious Disease Fellowship. The OIC Research Director, representation in clinical research has always been a very big passion of mine. It's something that I have been working on in almost every single step of my career, trying to make our research services more accessible to the diverse communities that our clinics serve. It is well known that the HIV epidemic disproportionately impacts communities of color, diverse communities, vulnerable populations. And so it's important to have those populations represented in clinical research. One thing we've done in research for many years in the history of HIV medicine is extrapolate results from populations to other populations that may not necessarily have the same background, may not necessarily have the same social circumstances, may not necessarily have the same pharmacodynamics and pharmacokinetics. And all of those factors really impact how drugs work. And so it's very important to include a diverse community in clinical research so we have an idea of how drugs work in a large number of communities. Right now, it's something that our field has really been struggling with. At the OIC, we've made very concerted efforts to include more diverse communities, but it's something that obviously we still have room to work on. Most of the clinical studies in HIV medicine that have led to the approval of all of the commercially available drugs have predominantly included men, right? We're talking about 70 to 90% of the study population has been men. And we know that the FDA thinks that that's unacceptable. And they have put a real pressure on us to include more women, and especially women from more diverse backgrounds, in research. And why is that important? There's so many reasons why that's important. It's because obviously, I don't need to say this, and I don't mean to make you laugh, but women are different from men, right? It's really important to think about why that is and how that relates to the products that we study for both HIV and HIV prevention. Pharmacokinetics are different, so the way we process and metabolize drugs are different, right? Pharmacodynamics are different. How drugs work and their different receptors, those are very different between women and men. Women, we have these things called estrogen and progesterone, the sex hormones. They impact the way we metabolize drugs. It is not acceptable for us to take data from men and just think that that's how that drug is going to act in women. From a biological basis, it's super important. And then let's not forget about that thing called pregnancy, right? Women can get pregnant and men, count your lucky stars, you cannot. Speaking from someone who was recently pregnant. So, that also plays a big role. PrEP in women. I can go on and on about PrEP in women. It is such an important topic topic. It is a topic that we don't talk about enough. I think people have started to recognize the importance of PrEP in women, but we haven't actually taken the steps as a field to implement PrEP in women in what I think is an effective manner. You know, women, even though the rates of HIV have been declining in women over the past few years, women still account for 20% of new HIV diagnoses in the United States, and 85% of that is through heterosexual contact. So clearly there's still a need for PrEP in women. Here in Orange County, if you look at the actual local statistics, you know, women over 50 is still one of the only groups in which the number of HIV cases is still increasing. It's actually decreased in every other single demographic, right? And so I can't underscore the importance of HIV prevention options for women. We haven't done a good enough job of making women aware of PrEP. We haven't done a good enough job of offering women all of the available HIV prevention options. It's not something I think that a lot of providers are very comfortable talking to women about. And so at the OIC, we have been working to create sort of more innovative ways to get PrEP out to women. And actually, we do have a study that's going to start enrolling soon. It is a PrEP study for women. We're specifically targeting women of color because we know, again, those women are disproportionately impacted by the HIV epidemic. And that study is actually not going to have its primary location at the OIC. That study is going to run out of a community-based organization that's already devoted to PrEP in women, that's out in the community, that's easy for women to get to, that's been serving women in the community for many years. And the provider that's going to be providing PrEP is the actual founder of that organization, who's a pharmacist, Dr. Andrea Dunn. She's going to be providing the PrEP in that study. Andrea Dunn has been working in PrEP in women in the Orlando community for a really long time. And so it's something that we're hoping that women can look at her and feel more comfortable going to her to get PrEP, especially outside of an infectious disease practice in the community, in an organization that has been devoted to them for a very long time. And so again, that's just one of the steps that OIC has taken to address the problem of the underutilization of PrEP in women, and we're so excited about that study starting soon. There's very little we know about how HIV drugs work in pregnancy, and why is that? It's because women are excluded from HIV clinical studies when they're pregnant, right? Women have to sign a bunch of papers saying that they are not gonna get pregnant if they participate in clinical research. As a woman, as a researcher, I don't find that acceptable. I know a lot of the field has been moving to not finding that acceptable. At a recent conference, there was a very big, long talk about how we needed to get rid of that antiquated idea. There has been guidance from the FDA on how to go about including pregnant women in clinical research. And I think that that's something our field knows about, hasn't really tackled quite yet, but we are starting to see more of that in terms of studies allowing pregnant women to stay in the study if they become pregnant. We have a few studies like that at the Orlando Immunology Center. We have a PrEP study coming up, again, for women, and I would like to say that in our PrEP study for women, I fought very hard to keep women who become pregnant in that study. So that's just an example of something that we're doing here at the OIC to kind of address that. But again, so many biological sex differences between men and women, and we need to work harder to get women in research so we can figure out what those differences are, see how they impact how drugs work, and actually take that information and implement that into clinical practice to better serve women and their sexual health needs. What do young people need to know about sexual health services in Orlando? There's a lot of right answers to that question, but I think one of the right answers to that question is that young people need to know that screening, prevention, and treatment of sexually transmitted infections is available to them in the Orlando community, regardless of what their situation is, right? So regardless of whether they have insurance or not, regardless of what part of Orlando they live in, regardless of how they identify in terms of their sexual identity, there is a place in Orlando for everyone to get screened, for everyone to learn about prevention, and for everyone to get treatment. I would like to think that at the OIC, like, we are one of the best options. I would encourage our young sexually active folks in Orlando to seek out the service that is right for them. We would love to serve you. There is something for everyone in Orlando.